Alright, hello, this is group 1050 consisting of Bowen, Chen, Sam Flomenberg, and Ted Groth, and we have designed problem F. Alright, hello, we are representatives from EGGG Incorporated, and we are here to discuss a revolutionary new product to help the elderly population identify if they have a spinal fracture. So what's the huge problem of finding a spinal fracture? Even with modern medicine practices, it's very difficult to identify a spinal fracture. And in its very early stages, MRIs and X-rays cannot clearly show that there is a problem. And when someone first gets a spinal stress fracture, it just feels like a small pain in their back, so they really don't know the difference. And these stress fractures can be caused by traumatic injury or osteoporosis, which is a degenerative bone disease mainly found in women over the age of 50, and also men in their 60s. So if you let spinal fractures be in your body for a long period of time, it can cause severe deformities in the back called hyperkyphosis, which is the hunchback syndrome, and it's not very healthy, and hyperkyphosis can also cause shortness of breath and difficulty in movement, which is never good. So because spinal fractures are so hard to detect, only a third of people in the United States can actually find, only 1/3 of them are actually helped. So we are here to change that at EGGG, and we have the solution. We have developed a special package for the elderly to use to help them identify their issues so that they can seek help for back fractures. But before they buy this product, we also recommend taking our online survey to determine if our product is right for them. It's a very short 5-question survey, and if the survey indicates you need this product, we highly recommend you purchase it. So let's go through our package. The first test that we have in our package is called the airbag test. Now what we have here is an airbag, and it also has a special gauge on the side. And what the elderly person should do is sit in the chair, and if the person has a spinal fracture, their back is slightly deformed, so they're hunched over a bit, and that means that they would exert less pressure on the bag than a normal person would. So if less pressure is exerted on the bag, the gauge will indicate this, and if the pressure is significantly less, then it will indicate that some type of spinal fracture may be present. So that is the airbag test. We also have something called the string test. And the string test. Alright, so the string test consists of a metal strip which you can wrap around the shoulder and back to capture the shape of one's back. And after that is captured, you can compare it to special sketches in our booklet that we provide with our package. And if the outline of your back matches moderate to severe cases of spinal fracture, we advise seeking help. And our third test is called the center of mass test. And again, spinal fractures cause deformity in the back, very slight deformities. And these slight deformities can also change the center of mass of someone's body. So for this test, we have 2 set masses we will mail to you, and we ask you to stand a certain distance away, and that's determined by height and mass and other things also found in our booklet. And if the person is slightly hunched over due to a spinal fracture, then it'll be a lot more difficult for them to lift these masses. So that test will help determine if someone has a spinal fracture as well. So if you have any trouble with any of any of these tests, we advise seeking medical attention. So we're going to turn it over to Mrs. Chen to discuss our business terms.
Alright, so right now we need $3,000 to buy pilot kits for critical test. We expect this to return 5 times the investigative volume, and thank you for watching. Bye.